Welcome back into WDHN at Daytime. Now, this month is a very important month for those undergoing heart health issues. Now, it is Heart Health Awareness Month. Now, I'm here with Dr. Pandit, a cardiologist with Southeast Health, to talk more about that today. Thank you for joining us.
Thank you. Thank you for having me here.
Of course. And now, can you just really express, the importance of advocating for Heart Health Awareness Month?
Well, I think it's important that every person should know what their numbers are. That's one of the campaigns that's been going on with the American Heart Association, ACC, over the last many years. The key is to know what your blood pressure is, what your cholesterol is, what your hemoglobin A1C is, which could indicate diabetes, and what your BMI is as far as weight goes. So if patients know what they are, they can improve on them, they can make that better. The lower the risk factors, the lower the risk, the less likely they'll develop heart disease down the road. And so the other thing that becomes important is also risk factors. Certainly there are risk factors that we cannot change. Family history of heart disease, getting older. We all are going to get older. Nobody's getting younger, I can promise you that. So those two risk factors we can't change, but there are other things that we can help with, and the patients can do it themselves. Blood pressure, cholesterol, controlling diabetes, not smoking, exercise, diet, things like that. So all of those things become important. So the more the patient knows, the more the person knows their risk factors, the better they can manage those, and then that way they can decrease their risk of heart disease.
And I feel like another important thing, for heart health awareness is really knowing CPR. It's very important for that. And can you just really tell us, for those who don't know CPR, the steps to learn it?
Absolutely. So there are certainly local associations that can teach CPR, there are firehouses and things like that. Hospitals also have programs that can teach CPR. I think it's very important for even a teenager to know how to do CPR, because it becomes vital in somebody that collapses outside of a hospital setting, because initiating that immediately can make a huge difference in whether the patient lives or dies.
And with Southeast Health, do they provide any resources for anybody who are currently undergoing heart health issues?
So currently we have 6 physicians. I just started with Southeast 2.5 weeks ago, but I've been doing cardiology, interventional cardiology, for 32.5 years now. We have physicians that do all types of procedures, including interventional procedures, putting stents in, doing valves, doing pacemakers. So every aspect of cardiology is covered in our hospital, and we're happy to help anybody that would like to come and help get that.
Yep, and it's an important time to really, educate people on those risk factors, and even steps to learn CPR, very, very important. And Dr. Pandit, thank you so much for coming on Daytime to talk more about it today.
Thank you very much for having me.